Back pain is bad, but when it keeps coming back again and again, it's even worse. Today, I'm going to talk about why your back pain keeps coming back, the top 3 culprits that keep you from truly healing, and what you can do to break the cycle. Hi, I'm Dr. Moss, and today I'm going to share with you my over 28 years of experience as a physical therapist in treating thousands of patients with back pain, including my own back pain. Okay, so let's get started. The cycle of recurrence, why your back pain keeps coming back again and again. First of all, usually we see this in patients that are 30 to mid 50s. Okay, I'm in that bucket now. However, it usually relates to an injury earlier in life. Okay, and so the research shows us that 70 to 80% of people that have had one episode of back pain are likely to have another somewhere down the road as they get a little bit older. And so it's not really the real injury or the initial injury that causes all these problems. It's what you do or don't do after that initial injury that leads to recurring back pain. So a lot of times it's underlying movement patterns that aren't very good. It's muscle imbalances. It's joint stiffness and tightness that overall leads to loading of the low back pain tissue or the low back pain tissue. And then all of a sudden the pain starts to come around. Most of the time, this is not truly addressed, and I'll talk about that in just a moment. So this, a lot of times, if not truly addressed, it leads to this vicious cycle of dangerous pain meds, injections, and sometimes leading to low back surgery. So most of the time, the low back tissue is going to heal on its own in about 6 to 8 weeks, and you start to feel better and you start to have less pain. However, this doesn't mean that everything is 100% healed, okay? This becomes a true fork in the road, which leads to successful healing versus potential surgery down the line. If you're finding this video helpful, please like, share, and comment below. Also, don't forget to subscribe for future content. Okay, so what can we do it, and what are the 3 hidden culprits? So we've talked about the pain that starts to reoccur, and there's muscle imbalances and some joint pain and stiffness. So what should you really do? So one of the main things is people don't address their deep core stability, which leads to instability. So there are certain exercises that we'll talk about. We like to do the McGill crunch. We do the bird dogs, the dead bugs, side planks, band of Palloff. There's a lot of different exercises we can do. However, sometimes when you're hurting, those exercises may be a little bit too aggressive. So that's why you always want to get with a trained physical therapist to help design a specific program for you. However, we will link to a few exercises that we prefer to do in the clinic early on, which should be nice and safe for you. So that's one, not addressing the true muscle imbalance leading to that lumbar hypermobility or instability is the other thing that we'll call it. The other is what's called fear avoidance behavior patterns. All that means is that you know something in the past has hurt, and so naturally you avoid that movement. However, what happens is over time, your world starts to shrink down. And you start to do less and less because you're fearful that you're going to injure your back and you're going to have some pain with it. And so it's perfectly natural. You start to do less and less, and all of a sudden you find out you're having trouble just getting off the commode. Now, the third culprit, really, and hidden culprit, is most people, they do not fully complete their rehabilitation process with their physical therapist. Some of them don't even go to physical therapy. At my clinic, I've developed the magical 5 phases of healing process that we take patients through, and it starts at phase 1 and 2, where we're working on reducing that pain and inflammation. Then we start to work on their mobility, flexibility, and strength, that core stability, and then we progress them all the way back up into independence with the home program that they should be continuing on a couple times a week, and then also performance enhancement, which is phase 5. Okay, now, if you don't fully recover, and you stop early just because the pain is better, which is great, and you don't continue to work on your core stability, that's going to lead to this vicious cycle of now the tissue getting overloaded, it becomes painful, and now you're back to square one where you're having to get some pain meds, maybe some injections, because you're not able to get your pain under control. Now, the third portion of breaking that cycle is pretty much what I alluded to. We have to work on some what we call progressive loading principles, meaning we start you, we meet you where you are in your exercise activity and routine. We work you through these 5 phases of healing, starting with some pain reduction, following up, we'll start with addressing the stabilization and our stiffness. If you're stiff in the hips and thoracic spine, which is where most people typically are, which leads to more loading into the lumbar spine. The other part is consistency over time. A lot of times people get to that phase one, like I said, maybe some phase two, they're feeling better, they drop out of therapy, they stop doing their home exercise program, and guess what? It starts to come back. So once you get to that phase and you're independent with your home program and you're feeling pretty good, I recommend you continue to do that anywhere from 2 to 3 times a week, if not daily, depending on your routine and your lifestyle. And the third thing about breaking that cycle is I've been there. Not only have I treated thousands of patients, but years ago, my wife and I were on our 20th anniversary honeymoon in Hawaii, and I had a horrendous episode flare up of low back pain. I'd been dealing with some back and forth, but I'd been training a lot. I was doing a huge bicycle race coming up. We took this vacation. I don't know if it was the 8-hour plane ride. It was sleeping in a very soft, uncomfortable bed, but I woke up mid vacation just in excruciating pain. And so my story was working back through these stabilization exercises. I knew I'd been slacking a little bit on that. We got to doing that. Once we got back home, we used deep tissue laser in the clinic. I had my other clinician do some dry needling with me as well to get that pain under control. And I worked myself back through the 5 phases of healing, back to performance enhancement. So back on the bike, lifting weights, and having a very active lifestyle. So if you're having issues, these are some things we need to talk about regarding your back pain to prevent that recurring episode. Okay, so practical first step is if you're feeling good and you're really not having any pain, but you have had some in the past, we'll put a little link. We'll put some exercises in there that we recommend, kind of a phase one, maybe a phase two, make it a little bit easier, then some progressive things you can look at. Also, if you have some comments with back pain, how's it gone for you? Did you have surgery? Were you able to avoid surgery? Do you have a routine that you do to help keep your back pain in tip-top shape? Just go on and put it down below in the comments. And in the next video, I will cover a quick 5-minute morning routine that I use personally to help keep my back pain in check all day long. Thanks for subscribing and have a great day.